Hey mamas, welcome to Breastfeeding Relief with Bethany. We share incredible stories, tips, and breastfeeding ideas to help on your journey. I'm your host, Bethany Laverne, a lactation consultant and speech therapist who helps mamas with breastfeeding. Not all breastfeeding stories are the same, and we dive into those topics. Welcome to Breastfeeding Relief with Bethany. Dr. Nina, it is so good to have you on today. She is a pharmacist and the owner of oogiebear. So why don't you go ahead and jump in and tell us a little bit about yourself and how many kiddos you have.
Hi, Bethany. Thank you so much for having me. This is so much fun. And just for your audience, I'm a pharmacist with a doctorate because a lot of people come back and say, how is she a doctor? So just a FYI. So I have 3 kids out of the breastfeeding age, and we've had quite of a journey with each and everyone being different on their own. But my first daughter, who has put me on the spot, and the reason why we're talking, really challenged me. And I ended up having a beautiful journey. So initially it was really rough, and would love to dive into the details if you like me to.
Yeah, absolutely. So why don't you go ahead and just tell us about her beautiful journey?
Okay, so initially, first time mom, I had a baby, and as you know, being in the medical field, I knew the importance of nursing. I knew the importance of breastfeeding, and I knew that is what I'm going to do. I'm set. I'm prepared. Here we go. And lo and behold, she had a lot of breathing issues, and she could not latch on. I didn't know this at that time. She just could not latch on. And I had wonderful lactation consultants initially in the hospital that were trying to help me, but her mouth would open up like a little bird and not actually be able to put my breast in her mouth and be able to suction. So it was so difficult, I have to say. I want to say a month, but I think it was longer than that, maybe a month to 3 months of just really painful suck. I mean, I remember when she was sucking on my nipples to be able to feed, because she had to feed, right? My eyes would roll back. That's how painful it was. And if anyone knows me, I'm so stubborn. If I say I'm going to do something, I'm like, I got to get this right. There's something wrong with me. I got to figure out, we all as moms always put that burden on ourselves and think that we're broken in some way or shape or form. And I knew I did not want that label. And I was very adamant that this kid is going to nurse and I'm going to have a very beautiful journey. Lo and behold, after that phase of just not giving up, and I guess my body, mind, everything connected, I started producing more milk, and she was able to open up her mouth more. And we had a wonderful journey of 9 months of breastfeeding. And I was a working mom, and I don't know if that would have gone to a year, but initially I thought, I think everyone's very they come up to terms of how long they want to breastfeed. Because my other 2, I ended up breastfeeding up to a year. And my last one, my son, I ended up breastfeeding almost 13, 14 months with him. So every child was different and their needs were different. And I think I had an easier time as I had my second child, as I had my third child. But each and everyone was just a beautiful journey. You have that bonding with your child, looking into their eyes, it creates that bonding, the skin to skin. I mean, there's just so much I can go on. And I think it's just such a beautiful journey in that sense. And believe me, that first month with Ariana, who was my first, was just incredibly difficult. And I know a lot of moms go through that. And I don't want to, advocate that you have to breastfeed, because I know sometimes you can. And I probably would have given up if she did not get better and better over time. So I think if it's a choice, I think we need to breastfeed. And if you can't, well, then we are so fortunate and lucky that there are other options. So I hope I answered your question. I don't know if I'm just, keep going. I'm just going on.
No, that's so wonderful. I love that you share with mamas. I mean, the point of my podcast is every journey is different. none of your children are going to be the same. I have two boys. They were completely different. My first one was so easy. My second journey was so hard with a tongue-tied baby. And so I appreciate you sharing those so different. And sometimes I also feel with maybe we might think it's our last baby. We hold on a little bit longer because we know we're never going to do this again. And we just love that special time with them. So, but I love how you also said, it's your choice. It's your journey, right? I'm here to support you no matter what. I'm here to support you if you want to make it 6 weeks, 8 weeks, 12 weeks, going back to work. I want to help you on that journey. And then you say it's too much to take all my pumping stuff to work, right? Or if you want to do a year, 2 years, I am here to support you, mamas. I want to help you one-on-one, and I can help you for 30 days, and you have unlimited 24-hour support from me. And I will get back to you with all of your questions. Please send me pictures and videos and voice messages, or text me, especially at 2 and 4 a.m. when you guys are feeling so lonely. So thank you so much for sharing that.
I needed you. Where were you then?
Oh, I'm so sorry.
No, that's so wonderful. That's so wonderful what you say, because it really is individualized.
Mm-hmm, mm-hmm. So why don't you tell all the mamas, what is one thing you wish you would have known about breastfeeding?
So I knew the importance of breastfeeding, right? I knew it medically. I knew it as a mom. I was told, generationally, like, oh, we breastfed all the time, so you want to keep that standard, right? But after really understanding breastfeeding, it is just remarkable how truly important it is. And it's really not at the time that you're breastfeeding. It starts when you get married and you decide that you want to have a kid, because what you put in your mouth, how you eat, the environment you are in, your stressors, all that plays in the role for you to eventually have a baby and the womb, and then want to breastfeed. So I think there's so much. I think if I want to, even like I have two daughters, if they ever breastfeed, I want them to know the most important thing is that, one, do your best to try to best breastfeed, but know that the journey starts way before that you even think before you're breastfeeding, for me, it's just so amazing that you have this newborn come into the world and you are the vehicle for that newborn to survive. So you pass on all the immunity, the minerals, the vitamins, that colostrum, that thick yellowish substance that initially comes out. And it's so difficult because it's really, you expect like milk to be pouring out, and it's not. It's this thick substance that you're like, what the heck is that? Or at least that was my impression when I first saw it. I thought, again, you start thinking something's not right. And we're so quick to say that, right? But that right there is passing on your immunity, the antibiotics, the minerals, the vitamins, that baby, if they have an infection. And talking about RSV, right? Most important time for you to pass on that immunity. During this season that we're in, you're starting to see a lot of signs and symptoms that you're worried about. And so just, I think I would hone in on the importance of that breastfeeding beyond what we think we're feeding our baby. It's more than that. And forget about the bonding, the connection you make with your baby, the eye-to-eye connection, your skin touching on skin, calming the baby. There's just so much benefit. I could keep going on and on and on. I'll bore you guys to death, but I think that's what I would pass on, is how important that is.
I specifically love how you said when you and your husband or you and your partner have decided to go forward and decide to start having a kid, before you get pregnant, I love that we need to start doing research. And I feel like maybe in today's society, we're more concerned around how pretty the nursery looks and what we're going to be putting on our baby registry. And instead, I have so many moms come to me and say, I so regret not taking a breastfeeding class. Yeah, Yeah. And so, mamas, do your research. There's so many great podcasts, so many great books. I know we're all busy and working. And so if you don't have time to take that class, there's so many digital classes now too that you can take. Or even just know your resources, like myself. Like, you might not have a kid yet, but I have a lot of women that follow me, and I'll be like, hey, how can I help you on your breastfeeding journey? And they say, I'm not breastfeeding yet. I just want you in my back pocket, and I want to learn a whole bunch of stuff so that if I do have a problem, I know I can call you tomorrow.
That's amazing. That
Mhm.
is truly amazing that they have a resource like that. And I learned that after my first kid. I saw the importance of that. Again, I knew the importance of it, but really how to. And I think I got better at it with each kid. So 100% agree with that.
Yeah. So, what is one of your favorite breastfeeding products?
I'm very biased here, but I have to say the Oogie Bear, the Oogie Boogie tool, as we refer to it. Oogie Bear allows you to clean the baby's nose. Actually, that is why I have a business. My baby, I told you, firstborn, was not breathing very well, and I think that's probably why I had a lot of latch. She couldn't latch on very well. I didn't know at the time, but that was probably contributing to just her having a difficulty time. The Oogie Bear, out of the blue, she couldn't breathe at night. She kept keeping me up through the night. I was a working mom, and I could not believe that there was nothing on the market that addressed boogers or hard mucus, which is what blocks babies' nose when they want to breathe. More importantly, when they're breastfeeding, you want to, not only if they're mad, you want to calm them down, because we're in this season of RSV, right? So you want to make sure what's going on. Are they sick? Is their nose blocked? Do they have a temperature? Why are they not latching well? So many reasons why, right? And I would say the number one product would be Oogie Bear, to making sure that their nose is not blocked and they're able to latch on and be able to have that beautiful breastfeeding journey, hopefully.
Mm-hmm. Yeah, I love that. And specifically, mamas, I think about, this is more from my speech therapist aspect, what I've been going through and doing some extra research on with myotherapy, is your baby should be breathing through their nose, not their mouth, mom. And so if they are breathing through their mouth, you need to shut their mouth so they're breathing through their nose. And again, like Dr. Nina said, they might not be able to because it's all stuffed up. I also highly recommend moms to run a humidifier in their room to help moisturize it. Their nose, it's so good for them. And also, if we think about good mouth posture, which I feel like we don't talk about a lot, your teeth should be apart, your lips should be together, and your tongue should be right behind your teeth on that bumpy ridge, and breathing through your nose. And so if we can teach our babies that early, that's just so good for their health. I know that sounds crazy, but it's so good for their health. It will help them sleep. They will hopefully stop snoring. And the biggest thing I've learned recently, it will also help spread out their palate, which hopefully, mamas, means you're going to have less money to spend on braces, or spending less money on braces because your tongue's doing all that work to widen their palate for them.
Absolutely. And, that Oogie Bear started us on this journey. And now we've made it our mission to help babies breathe better. And we have a Oogie Bear teether and a toothbrush that does exactly what you just said. And I'm so happy that you actually understand the concept behind that, because not only it'll help you breathe and, of course, immediately, comfort the baby, but cognitively throughout their lives. I mean, if you have a mouth breather, how many times have you seen a cartoon episode and the one that's really not like paying attention or just not so smart is a mouth breather? So it is so important from day one that we close that mouth, and we've got all the necessary tools that help with that, whether it's a toothbrush, teether, a nose cleaner. It should help facilitate that.
Mm-hmm. And I specifically love your teethers. So, of course, we know I call myself the tongue tie expert here. My son had a tongue tie. We went through that whole process. And so I'm always looking for new teethers to recommend to mom. And I just love this teether, one, the babies can hold onto it. So they're going to control it and they can put it in their mouth and they're going to move around their tongue. And so that's also strengthening their tongues, Mom, and it's strengthening their jaws because they're chewing on it. And it's also helping them cut teeth, which I love. And I bet, Dr. Nina, correct me if I'm wrong, it's okay to throw it in the freezer for those teething babies.
Absolutely. Absolutely. It'll help soothe the cooling effect, of course. Yes, absolutely. You can do that.
Yeah, I have a whole part of my freezer that's just teethers and cold things all the time. When they were cutting teeth, I threw one in, pull a new one out. Yeah.
That's I love it.
Awesome. Well, thank you so much for being on today. I've so enjoyed our talk. Why don't you let our mamas know how they can connect with you?
We're on all social media channels at oogiebear.com. We're, Instagram, Twitter, TikTok, all the platforms. And I'm so happy to be here. I really enjoyed this conversation, and I'm so grateful that the products are helping at least your clients and babies.
Yeah. So mamas, I highly recommend go buy some oogiebear products.
Thank you.
Thank you so much for listening in. If you loved this episode, it would mean so much if you would share it with another mama or post on social media and tag me. I want to personally thank you for wanting to help other mamas. You got this. I'm rooting for your breastfeeding journey.